I'm Arvind Singh. I'm a heart surgeon and I work at Essex Cardiothoracic Centre in Basildon, which is in Essex. And I work with the Keyhole Heart Clinic in London. I do full range of adult cardiac surgery, including repair of aortic valves, which is kind of my mission. This is in context with aortic aneurysms, which affect the aortic root, as well as the ascending aorta and the arch of aorta. I also perform a fair amount of minimally invasive cardiac surgery. Minimally invasive surgery benefits the patients mainly in two ways, according to me. One is, of course, the physical recovery, which is significantly quicker than any full incision. And the other is the psychological aspect of minimally invasive cardiac surgery. The Keyhole Heart Clinic is actually a team which includes not only just the surgeons, but rest of our staff who are available from the first call till the last call during the journey of our patients going through their heart surgery. And actually, it is this journey which makes it memorable for the patient. As the name suggests, the aim here is to perform as many operations by a minimally invasive technique so that we get the advantage of early recovery and full satisfaction to our patients.